Today, aspirin, in a low dose, I might add, is used for heart attacks, strokes, pregnancy complications, diabetes, colon cancer, dementia, Alzheimer's. Today, it is the best known and most widely used medicine in the world, with an estimated 100 billion tablets swallowed every year. Actually, it's also used out of this world because every space shuttle has a little thing of aspirin in it. So, how did aspirin make it? There was never a low-dose aspirin movement or an annual low-dose aspirin convention. This is how it happened. After the first small study by Elmwood in 1974, and now Elmwood's evidence was a great deal smaller than the evidence we have for LDN, by the way. But, based on Elmwood's small study, 20,000 US doctors collectively proved that aspirin reduced the risk of coronary thrombosis by 44%. And they did this by collectively contributing to a database that stored patient results, and then they got a university to analyse their collective data. Now, doctors were happy to do this because they knew that aspirin was safe. Well, LDN is safer than aspirin. The benefits of taking one aspirin a day now are so widely accepted that it is considered unethical to perform placebo-controlled trials to prove the case. Now, as I speak, researchers from a university in Melbourne, Australia, are about to launch the biggest clinical trial ever conducted in Australia to assess the health benefits of aspirin for elderly people. They are going to recruit 12,500 people over 70 to take part. How? Well, they're going to use the same method the doctors use to prove aspirin for heart attacks. Participants will be identified from the computer databases of doctors who were co-investigators in a previous trial. Personally, I think that's genius. Aspirin has provided the perfect trial template for LDN. See, we need to get doctors and patients to agree to participate in an LDN trial. And to do this, all they have to do is enter all of the results into a database, and then we get a university to analyse the results. I'll get to funding in a minute. But imagine if LDN was the most swallowed pill in the world. Imagine the health benefits. The colon cancer study of aspirin involved a long-term study of 90,000 US nurses between 1976 and 1995. Those who took 4 to 6 tablets of aspirin a week were shown to have had a reduced incidence of colorectal cancer. Now, again, these numbers are all coming from a common database filled in by willing participants. It really is not that fancy, and it's very doable for LDN. I mean, we could even base our feasibility study on the one they're using in Melbourne. So the grandiose clinical trials for aspirin are, in fact, nothing more than randomized information from a collective database. It is patient evidence-based medicine at its best, clinical evidence, common sense, by doctors who are not afraid because they know that the drug is safe. Now, if we could get a university to record what LDN is doing for the 100,000 patients who are currently taking it, if we could get a university to design a database for all LDN doctors to record what LDN is actually doing, I think that would be a significant starting point. We have John Donnelly's LDN World Database, but I think we need to take it to the next level. We need to collectively get our data together. So what is actually going on with regard to LDN today? I heard people today saying, that we don't have the data, we don't have this. We really do. We have a huge amount of significant data. More is happening than ever before, and we continue to gain momentum. I've also learned from my radio show that many of us have different ideas as to how best invest our funds, energy, and time into getting LDN to the masses. At first, it was difficult for me to decide our best course, but now I think collectively getting our data together is the starting point. But to do that, we need to expand our grassroots. Now, as a group, we have not raised much money. We only tried once, thanks to the efforts of Vicky Finlayson, in California. She organized a fundraiser at the Lake of Pines in 2006, and with the help of many people, she managed to raise $25,000. I spoke at that event, and I remember that was a lot of money for us to raise, and it was a lot of hard work. And the money went to the University of California, Dr. Cree. Dr. Cree did the first human LDN MS trial. It was on 80 patients. The study was a huge success. After 8 weeks, LDN significantly improved the quality of life for participants. They had better bowel, bladder, sexual, and cognitive function, and were reported. And the only negative side effect was a transient period of vivid dreams. So Dr. Cree reported these conclusions of his trial in a presentation to the World Congress on Treatment and Research in Multiple Sclerosis, held in September 2008 in Montreal, Canada. But here's the kicker. His trial was never published. Now, I tried to find out why, but I couldn't. I mean, we worked hard to raise that money. That was $25,000, not a huge amount, but we needed that. We still need that trial to be published. Then we've got Dr. Jill Smith from Penn State. She put LDN on the map with her successful publication of phase 1 of her LDN Crohn's trial, and now she's in the phase 2. She's probably leading the pack in the when it comes to the publication of human trials. Then we have Dr. Gironi's trial for primary progressive MS in Italy. There's also a clinical trial of LDN in the treatment of fibromyalgia going on at Stanford Medical Center, and that was implemented in October 2007. Then we have Dr. Zagon's research. By all accounts, Dr. Zagon is pushing back the frontiers and spearheading LDN research in the lab. His work on his animals actually probably places him 30 years ahead of where LDN is going to take people in the future. He's a brilliant researcher. And he has published many papers. Then we have the trial in Malai with Dr. McCandless, to which the proceeds from this conference are all going. And I'm really happy about that because it's with HIV and AIDS that Dr. Bahari started. And the reason she's doing that trial, by the way, is because she noticed in her kids with autism that LDN altered their CD4 counts. And as soon as she noticed that, she said, we have to get this. We have to succeed with this trial in Malai, which we had been trying to do for years, but again, we couldn't get the funding, nobody would listen to us, so she ended up investing most of her personal funds into the trial. And what's interesting is even the guy who won the Nobel Prize for the discovery of HIV is quoted, he can be seen on YouTube saying that HIV can be eliminated if you strengthen the immune system. And the implication in the YouTube clip is that you'd strengthen the immune system using vitamins and supplements and everything. And he ends it with, but there's no money in that. But imagine if he knew about LDN. I think his heart is truly in the right place. So I hope to send him the published trial in Malai once it's completed. And these are, one of them has cancer and her cancer is no longer there. And another one has MS, another one has Crohn's. So, between them all, they have covered quite a spectrum of the autoimmune diseases, and they're incredibly passionate. And they managed to convince the UK celebrity doctor, Dr. Chris Steele, to, number one, make a video on YouTube, which everybody seems to do now, and number two, to actually present the petition to the UK government once they reach 10,000 signatures or something like that. And the purpose of the petition is to ask the government to fund clinical trials for low-dose naltrexone. So I'm thinking that when they do present that, they also have to present all of the evidence we have, the patient-based, the clinical-based, the published trials, even, hopefully Dr. Cree will publish his trial, but absolutely everything should accompany that so that no is no longer an option. Because any intelligent person who sits down and looks at the evidence we have can see that low-dose naltrexone is worth pursuing.